The flu season in the U.S. keeps getting worse. The Centers for Disease Control reported today that 16 more children have died, bringing the total number of pediatric flu deaths to 53 since the season began in October. The health agency is warning the peak is still to come. Dr. Nesochi Okeke-Igbokwe is back with us. Dr. Nesochi, why are children so vulnerable to this?
Children are so vulnerable to the flu, mainly because they're still trying to build up their immune systems. So when you look at the populations of people that are really affected by the flu, it's usually going to be children who are younger than 5 years old, and it's going to be adults greater than 65, pregnant women, and those with chronic medical conditions such as diabetes or any respiratory issues such as asthma.
So when we think of the flu, we think of there's a fever, there's chills, there's coughing. What is it that's actually killing these patients?
Most of the time, patients who are dying of the flu, they die more so of the complications of the flu, some of which include dehydration. We see that a lot in the pediatric population when they do get sick with the flu. They're losing a lot of fluids because maybe they're vomiting or having a lot of diarrhea with the flu. They also typically die of secondary infections. Most of the time it's from a secondary pneumonia. The immune system becomes so compromised when they do have the flu that they are more likely to get these secondary infections that can compromise the lungs and someone's breathing ability. And a third way people usually die of the flu is something that we call sepsis, a very severe infection which can typically cause organ failure and subsequently death.
So if you're a parent or you've got an older parent, when do you know you need to go not just to the doctor, but you need to go to the hospital?
There are a few red flags everyone needs to be aware of. The first one is a very persistent fever that just doesn't seem to go away.
And can't be touched by the usual remedies.
Exactly. The second thing that would make one need to go see a doctor quickly would be if you have symptoms that seem to dissipate and all of a sudden you think you're getting better, then it just comes back with more of a vengeance. When that happens, we usually think that's when you are having that secondary infection that can lead to those deadly complications. And of course, another telltale sign, if you are having difficulty breathing, you need to go see a doctor immediately. That's an emergency.
We've heard in some cases people have gone to hospitals and they've been told, oh, you're fine, or you just take this medication, you'll be fine. And then they end up taking a turn for the worse and they very rapidly fail. How is it that even in a hospital setting, sometimes doctors and clinicians are unable to spot the signs of somebody who's really going to be in trouble?
So the way that the flu works, sometimes patients can be asymptomatic, meaning that they're not even showing symptoms even though they've been infected for a 24 to 48-hour period. So perhaps when they've gone in, the symptoms really have yet to manifest to give one the sign or signal that, hey, there's something really wrong and this person needs to actually get treatment for the flu.
So the CDC says we're not yet at peak for the flu season. What can people do? Is it too late to go get a vaccine?
It's definitely not too late to get the vaccine. If you haven't gotten the vaccine yet, you should get it today. We are at week 11 of flu season, and typically it's anywhere between 10 to 20 weeks that it lasts till. So it could still go on for a couple of more weeks. The benefit of getting the flu, even at this later point in the flu season, is that it protects you. If you do actually get the flu, your symptoms will be less than somebody else who did not get the flu vaccination. If you do get the flu vaccination, you're less likely to be hospitalized due to your symptoms, and you're less likely to have any more complications. So there is some benefit in getting the flu vaccination, even though the efficacy this year is not so great.
So if you've got the flu, basic things that you should do: go to work, go to school.
If you have the flu, stay at home. That's protecting other people, and it's also going to protect you from getting even worse from others who may have it as well that you may see out in the open in school settings or the work environment. Another thing that you need to do is make sure you stay hydrated. Much of the time when people do have the flu, they tend to lose a lot of their body fluids, and that can really make them have to go to the hospital and require IV fluids and other things to give them the support that they need.
Great. Dr. Nesochi, thanks so much. So basic rules: stay home and hydrate, and don't forget that vaccine.
Exactly. Also wash your hands. That's another key thing.
Great. Thanks so much. Thank you. Next, a preview of the Super Bowl and a lesson on the dating game from a proud bird. You're watching Arise America. Thanks very much.